I'm going to give a few minutes before we get started. So we'll wait just a few minutes and then I will introduce our speaker. All right, well, I'm going to get started for the night. We have people that join us later. That will be fine. We can just let everybody in. So first off, I want to just thank everyone for being here tonight and sharing space with us while we start our first workshop in our series of reproductive justice at the LOAM. My name is Tanya Hunsey, and I'm leading the LOAM's Repro Plus Justice Initiative. If you're not familiar with the Ladies of Hope Ministries work, our mission is EPIC, so ending poverty and incarceration for women and girls. We do that with two pillars, one of them being sustainability programs, such as housing, food security, and career advancement. Our other pillar is policy and advocacy. And under that, we have programs of our Speakers Bureau, our EPIC ambassadors, and then our Reproductive Justice Initiative falls under there. Our Reproductive Justice Initiative also has a couple different pillars. One of our pillars is programs. So we were able to train 50 justice-involved women to become doulas in their community. The other piece of that is our policy agenda. And all of our policy agenda focuses around closing the disparities of health for people who are currently incarcerated and who are back in the community. With that, I'm going to pass it over to Mariah and let her give her presentation. Thank you.
Thank you, Tanya. I'm just pulling my screen up here. So I am super excited to be with everyone tonight to talk about STIs and HIV in real life. So tonight we're going to talk about sex positive education in a storytelling framework. So as Tanya mentioned, my name is Mariah Wilberg, and I use she, her, hers pronouns. I do like to share with people. Please don't be distracted by my voice. I have a condition that affects my vocal cords, so this is just how I sound. All right, I'm just working on advancing the slides here. All right, so today we're going to cover HIV. We're going to cover sexually transmitted infections, or STIs, also known as STDs. The intersection of HIV and STIs with pregnancy, birth, and breastfeeding. We'll talk a little bit about prevention, especially new methods of HIV prevention. And then finally, we will discuss stigma and how you can talk to clients. All right, first, a little bit of housekeeping. There will be times when I may ask participants to participate using the chat function throughout the presentation. I do want to give a trigger warning. I will be discussing my personal story. Some of that is some heavy stuff, so take care of yourself. Step away if needed. I do want to reiterate, this is only one story, right? And everyone has their own story, and talking about experiences like HIV and STIs everyone can experience those differently. So just keep that in mind. This is just one story that you're hearing. And then if questions come up throughout the webinar, please use the Q&A feature and put them in there, and we will have time for Q&A at the end. Also, if you see me periodically glancing away, I'm looking at my other screen to at my outline and my stats. So that is why. All right, so I will jump right into my story then. I ran away from home at 17. I grew up in a nice middle-class household out in rural Wisconsin, and I was a pretty naive person at my age. I would say I was very sexually inexperienced. The sex education that we did have was really fear-based. It wasn't talking about pleasure or orgasms or sex should and can be fun, and it's a normal part of life. It was very much about scare tactics. And I didn't get a lot from it. So I was not very popular in high school. I didn't have a lot of boyfriends or anything like that. So when I ran away from home, I was kind of, I would say, a target for people. And I didn't have really a healthy sense of self-esteem. I was very easily pressured, including into condomless sex. So that's kind of the first point I wanted to touch on, is something I wish they had taught me in sex ed, and something that should be kind of talked about in all sexual health education is consent. So here's a little graphic from Planned Parenthood, kind of talk about consent being freely given. That means this is given without pressure or manipulation, and it can't really be freely given if you are under the influence of drugs or alcohol. Reversible, meaning you can stop and change your mind at any point in time. It doesn't matter what you're doing or what you said you would do. Informed, you can only consent to something if you know the whole story. So you might consent to sex, but maybe you're not consenting to sex without a condom. And then enthusiastic, you should only do stuff you want to do, not just things you feel like you should do, or someone is pressuring you to do or asking you to do. And then specific. So saying yes to one thing does not mean that you are saying yes to other things. So as I said, I didn't have that kind of sex education, very easily pressured, wasn't very good about using condoms. So my first actual experience with an STI was when I went in for my first pap smear at the age of 18. And there I learned that I tested positive for human papillomavirus, or HPV. So HPV is the most common sexually transmitted infection in the United States. Nearly all sexually active men and women will get HPV at some point in their life. And there's an estimated 42.5 million people who have ever been diagnosed with HPV living in the United States, with about 13 million new diagnoses in 2018. And the stats I share today are all from the Centers for Disease Control and Prevention, and they're all the most recent statistics that are available. So HPV is caused by a virus, actually a family of similar viruses. So there's dozens of different kinds, and it's spread through vaginal, anal, and oral sex. Most infections clear the body on their own, and while it's not curable, it is treatable. Some of the strains of HPV can cause genital warts or cancer, typically cervical cancer, but also sometimes oral cancer, cancer of the penis, things like that. There is a vaccine available for those aged 9 to 26. And for those who are over the age of 26, you may still be able to discuss it with your healthcare provider and see if getting the vaccine still might be right for you. And then they test for HPV during your annual pap smear. So there's actually no approved HPV test for men. They only test folks that have cervixes during their pap smear. Moving back along. So my experience with HPV was having this kind of abnormal pap smear test results. And then they did a test called a colposcopy. And that's where they get a really close look at your cervix. And they can also take a little sample of the cells so that they can look at them under a microscope and see what they look like. So mine, they did that test, they looked at them, they said, you know, you have these abnormal changes, and this is something you just need to come in and monitor every year. And by the time I went back for my next pap smear, there was no longer any abnormal cells, and it had cleared my body. So pretty shortly after I ran away from home and after this experience with HPV, I actually became homeless. And along the way, I met an older guy who was like, you know, oh, you don't have any place to stay, I'll take care of you. And he got me a hotel room, and he was getting me food and taking me out to eat and things like that. And what I didn't realize at the time was that he was grooming me. So at one point in time, he drove me to a house in a neighborhood I'd never been to. And he said, you owe me for everything that I've been doing. And you're going to go inside and have sex with that guy. And he's already paid me, and you have to do it because you owe me. And I was really naive. I was like, I would never cheat on you. I love you. What are you saying? And so he actually threatened me with a weapon at that point, and I ended up running away from him and running away from my wallet, my ID, my birth certificate, all the clothes I had, and I really had nothing. So I did shortly after that start doing sex work, which I really think of as survival sex, because I felt like I didn't have any other option. So I was living on the streets, you know, sleeping outside, things like that. And I was doing street-based survival sex for several months. And then at some point, I had started getting a lot of pain in my abdomen, and I knew something was wrong, and I went into the emergency room. And then they did some tests, and they told me I had something called pelvic inflammatory disease. So this is an infection of the reproductive organs. It's often caused by untreated STIs, but it can be caused by other bacteria that aren't an STI and douching. So you should never douche. The vagina cleans itself. And pelvic inflammatory disease can lead to complications such as scar tissue, which can even cause infertility or ectopic pregnancy. So this is something you need to get checked out and treated right away. So I found out that my pelvic inflammatory disease was actually, I skipped a slide. No, okay. Actually due to untreated gonorrhea and chlamydia. So gonorrhea is another really, really common STI. In 2019, there were a little over 600,000 cases, which is a 56% increase from 2015. It is completely curable with antibiotics, and it is transmitted through vaginal, anal, and oral sex, and it can be given to a baby during delivery, which can cause health problems. Chlamydia is the other thing that I was diagnosed with at that time, which is also caused by a bacteria. This one is more common than gonorrhea. In 2019, there was 1.8 million cases, which was a 19% increase from 2015. Also curable with antibiotics, spread through vaginal, anal, and oral sex, and it can be given to a baby during delivery and cause health problems. So I was a little bit confused. I was like, I didn't really notice any symptoms until I started getting this pain and I have this pelvic inflammatory disease. So I was like, am I missing something? So the first question I want you all to put in the chat, what is the most common symptom of an STI? All right, and I know there's a few of us, but you can fire up your keyboard and just pop that in the chat. All right, we've got pelvic pain. Good answer. All right, so actually the most discharge, another good thing to think about when we're thinking about symptoms. So actually the most common symptom of an STI is having no symptoms at all. That's why it is so important to get tested regularly and not wait until you feel like something might be off. So if you do have symptoms, these are symptoms that you should watch out for. These would be things like unusual discharge, if there's an unusual or bad smell with your discharge, burning or pain when peeing, lumps, bumps, or rashes, blisters and sores, any warts, unusual bleeding, or if you bleed during or right after sex, unusual pain during sex, itching, and then again, that lower abdominal pain or pelvic pain. So those are symptoms you want to watch. So I ended up getting that pelvic inflammatory disease treated by treating the chlamydia and gonorrhea that had caused it. And I'm still doing sex work, and it's maybe a few months later, and I started to break out with blisters all over my genitals. So I went back to the emergency room and I said, something is wrong. And at that point, they diagnosed me with herpes. So herpes is another very, very common STI. Almost 19 million have ever been diagnosed with herpes as of 2018, and over 500,000 new cases are reported every year. So it's caused by a virus, actually 2 viruses, herpes simplex virus 1 and 2. And it's spread through vaginal, anal, and oral sex, and it's actually spread skin to skin. So it can cause sores on the mouth, such as cold sores, which can be spread through kissing, or it can cause sores on the genitals, which then we call it genital herpes. You can have herpes for many, many years without knowing. They don't usually, when they test you for herpes, they don't test your blood just to see if you have antibodies for it. They only diagnose you with herpes if you have symptoms. So you can have herpes living in your body for years and it's dormant, and then all of a sudden you have your first outbreak. So that can cause problems sometimes when people don't know that they can have herpes without knowing it. Sometimes they're like assuming that maybe their relationship is not monogamous when they thought it was. So that's a really common misconception. So something to remember, you can have herpes but not know it and not have symptoms for years. It's not curable, but it can be treated. So either there's 2 ways you can treat it. You can either take medications when you have an outbreak, or if you have genital herpes, you can also take a daily medication, the same medications, you just take them daily, and that will actually prevent you from getting outbreaks in the future. And that might be right for a person who has genital herpes that has frequent outbreaks. So it's something to talk to your healthcare provider about. Something else they also tested me for when I showed up at the emergency room was syphilis, because syphilis is another STI that causes open sores. So syphilis is caused by a bacteria. It's pretty common. In 2019, there was 130,000 cases, which is in the whole United States, which is actually a 74% increase from 2015. It is curable with antibiotics, and it's spread through vaginal, anal, and oral sex. It is a spread through skin to skin, so condoms can reduce but not eliminate the risk for syphilis, because it's possible that it could be spread from an area that is not covered by a condom. Syphilis can be really serious and even fatal if untreated, and people can have syphilis for many, many, many years, and then it can start to cause health problems later, 10 to 30 years after they acquired it. Syphilis is also really serious during pregnancy. It can spread to the baby, causing stillbirth, illness, or death. And from 2012 to 2019, rates of congenital syphilis, meaning the baby got syphilis, rose 477% increase from 2012 to 2019. And the most recent data shows that there was over 2,000 cases of congenital syphilis in 2020. So if you are working with pregnant or birthing folks, it's really, really important to talk about syphilis and syphilis testing because of this big rise in congenital syphilis. So syphilis is it's been called the great pretender, because the symptoms they're not always the same, and they can often mimic other illnesses. So it goes in stages. The first stage, you get kind of a painless sore in the area where syphilis entered the body. So this can be around the mouth area or around the genitals. It can be inside the vagina or inside a butt. So then that sore will eventually go away, whether you've been treated or not. And then some people have symptoms during stage 2 of syphilis, which is 4 to 10 weeks after exposure. And those symptoms can often include a rash, and especially if there's a rash on the palms of your hands and the soles of your feet. And then those symptoms are going to go away whether you get treated or not. And then you go through a long period of time when you're not having any complications from syphilis or any symptoms, but then later it can start to affect your internal organs. It can cause mental health problems. It can cause blindness and even death. So syphilis test is a very simple blood test, and again, is treatable and curable at every stage of infection. So where was I? So I had just been diagnosed with herpes. I was still homeless, still doing sex work. And then around this time, I met someone and got into a relationship with him. And we got an apartment, and I stopped doing sex work, and I started going to school, and I got a job working at a call center. So I was like, maybe this horrible part of my life is behind me. And after after a while, I found out I was pregnant. And I was excited because when I had pelvic inflammatory disease, I really walked away with the idea that maybe I was infertile now, because they told me that was a possibility. So I was excited to be pregnant. So I went in to get my pregnancy test confirmed and to get on some health insurance. And they did a series of tests. So these are the recommended tests for folks to have during pregnancy and birth. So the first prenatal visit, everyone should be tested for syphilis, HIV, hepatitis B, and hepatitis C. And then they should also test for chlamydia and gonorrhea if the person is under 25 or at increased risk. And then again, in the third trimester, you want to do another test for syphilis and HIV for certain groups. Or if there's no earlier test on file, you want to do the chlamydia again if you're under 25 or if there's continued risk, and then gonorrhea if there is continued risk. And then at delivery, they do usually test for syphilis and HIV again for certain groups, or if there's no earlier test on file, and then hepatitis B if symptoms are present or a person hasn't been screened earlier. So I got called into the clinic to come back and talk about some of my test results. And I went in there and they brought me in the back room, and there was a nurse and a social worker, and they kind of knelt down and took me by the hand and said, Mariah, your HIV test came back positive. And I was shocked. I was like, I didn't even realize they had tested me for that. What does this mean for me? What does this mean for my baby? I was crying, and it was a really difficult thing to hear because I didn't get a lot of good information about HIV growing up. I kind of felt like it was something that would never happen to me. It was something I wasn't at risk for. I immediately thought that I was going to die. So I didn't have a lot of education about it. So they said, go get your partner and go to this clinic, and there's an HIV specialist waiting for you, and they want to test your partner, and they're going to talk to you about how to prevent giving HIV to your baby. So the next question I have for you all to put in the chat, what body fluids contain HIV? And just put your answers right there in the chat. All right, moving on. Next question, how is HIV spread? And if you have anything, think you know the answer, pop that into the chat. So here are the basics about HIV. HIV is found in blood, semen, vaginal fluid, breast milk, and anal fluid. It is not found in enough concentration in saliva to be infectious. So that whole, if you drink a swimming pool full of saliva, you can get HIV. That's just an urban legend. It's not true. HIV is spread 3 ways. 1, through anal and vaginal sex without a condom. 2, through sharing syringes. And then 3, it can be transmitted during pregnancy, birth, or breastfeeding. Notice what's not up here is oral sex. So there's like this hypothetical risk that HIV can be transmitted through oral sex if you had a big gaping sore in your mouth or something like that, but that's not really what's happening in real life. The CDC doesn't list oral sex as a risk factor for HIV, and pretty much good rule of thumb, you want to have healthy mouth and healthy genitals when you are engaging in oral sex. So make sure you don't, maybe not after you got a tooth pulled or if you have gum disease, things like that. And then you wouldn't want to do oral sex if there's any open sores or cuts present on the genitals. So they ended up testing my partner and he did not get HIV. And I was really confused because at first I thought it was automatic. Well, if I have HIV and we are having unprotected sex, therefore he has HIV. And it's not actually quite that simple. Just being exposed to HIV is not the same thing as HIV being transmitted. So there are some factors that will make a person more likely to get HIV if they are exposed to it. And one, how much HIV is present. When a person first gets HIV, there's a lot of it in the body, and the more HIV that's present, the more likely it is someone else will get it. The type of sex you're having, anal sex, HIV is more likely to be transmitted than vaginal sex. And that's because the tissue inside your butt is thinner than the tissue inside your vagina. So then it tears more easily, which creates an opening for HIV to get in. Rough sex or any tears during sex, including micro tears, which are so tiny that you can't see them. So that's why lube should be your best friend. Sex during menstruation. Having another STI will increase your chances of getting HIV if you're exposed to it. Having any open sores, that's just a way for HIV to enter the body. And if you have a lowered immune system, such as that you have a cold or a flu or drug and alcohol use, can also lower your immune system. So the next question we answered, does he have HIV? No, he doesn't. Next question was, will my baby get HIV? And they said, with the medications, most likely not. So without any sort of intervention, about 1 in 4 babies, or 25%, would get HIV during pregnancy, birth, or breastfeeding. But with intervention and proper medical care, it can almost always be prevented, and that chance is less than 1%. So some of the steps they take to prevent HIV transmission to babies is taking your HIV medications as prescribed, seeing your HIV doctor and your OBGYN providers as you're recommended. Sometimes they will give HIV medications through an IV to the mom during the birth, labor and birth process. Vaginal birth is okay if the HIV is well controlled through medication. If it is not, they do recommend a C-section. It is currently recommended that you do not breastfeed the baby. And then the baby takes HIV medications after birth, which kind of helps them fight off any exposure to HIV that they did have during the birthing process. And then they do a series of tests, and then they let you know, the baby is typically HIV negative. When they do the test, they have to look for the actual presence of HIV in the baby's body, because if they do an antibody test, you share your antibodies with the baby. So those would show up as the baby has antibodies to HIV. So they look for the actual virus itself. So my daughter did not ultimately end up getting HIV. And as I was learning more about HIV, I had remembered a time when I got I got confused, because I remember going into the emergency room when I knew things were wrong and saying, test me for everything. And I thought they were testing me for, I got off track. All right, sorry. So first, I remembered a time I had got really, really sick with what I thought I had was the flu. And I went into the emergency room and I was so weak, I couldn't even make it out of my bed to get to the bathroom. And it felt like the worst flu of my life. And I went to the emergency room and I asked them to test me for everything because I knew I was at a higher risk because of the sex work that I was doing. And they were kind of like, you know, we don't see anything, and this is just some sort of viral infection, and go home and you'll get better. And they gave me some fluids. So looking back, I realize now that I was in what's called the acute phase of HIV infection. So the acute phase is shortly after diagnosis, when the amount of HIV in your body really spikes up really high. And you can see that with the red line. And then the blue line represents your T cells, which are your immune system cells that HIV attacks. So in the beginning, you get a very high amount of HIV in your body because your body's never seen it before. You don't have antibodies yet. It doesn't know how to fight it. After a while, it starts to make those antibodies and your body gets HIV under control. And you can go through a period where you have no symptoms and you don't know that you have HIV because your body's keeping it in check for a while. And not everyone has symptoms during that acute phase, but a lot of folks do. So something I was confused about was when I went in and said, test me for everything, I already had HIV by that point, if that flu-like illness was the acute infection. So why didn't that test show that? And that's when I learned that you have to specifically ask for HIV tests and syphilis tests. If you walk into a clinic and say, please test me for all the STIs, and a lot of people have experienced this, they might take a swab or have you pee in a cup. Really, they're only typically looking for chlamydia and gonorrhea. So you need to specifically ask for HIV tests and syphilis tests by name, and those are both blood tests. So if you've only given a urine sample, or if you've they've only taken a swab, they're not testing you for HIV and they're not testing you for syphilis. So I gave birth to my daughter, and as I said, she was HIV negative because I took my meds and I did everything I was supposed to do, and I went to the doctor when I was supposed to. And after she was born, I really started to struggle. So I just wanted to touch base on postpartum issues to watch out for, since I know that you all work with birthing moms. So these are some of the symptoms that folks might get if they are dealing with postpartum depression, trouble sleeping, appetite changes, some of the classic symptoms of depression, also feeling like uninterested or like you're not bonding with the baby. And then also folks can develop what's called postpartum psychosis. And that's where you can actually lose touch with reality and experience things like delusions, which are false beliefs, or hallucinations, which is seeing or hearing or experiencing things that aren't there, or just strange behavior and thoughts. So I just wanted to mention these. These are things to watch out for. I was experiencing what I now think was postpartum depression, and I didn't really get the support I needed. I was in an abusive relationship. I didn't have a big support system, and I really stopped taking care of myself. So I was so good about taking my HIV meds when I was pregnant, but then after she was born, I stopped taking them, and I was really struggling. So I'm going to talk about what are some of the reasons that people wouldn't take their HIV meds. And we call this adherence, taking your meds like you're supposed to. One of them can be privacy. Living with HIV is very stigmatizing. So if you're living with family and they don't know your status, and you're living at home and your mom just goes through your room whenever she wants, or your roommates do, or whatever it is, your partner, you may not want people to find your HIV medications. Side effects can be another one, although HIV meds now are really good with, and many people have no side effects from the meds. It could be an insurance thing, mental health challenges, substance use, intimate partner violence, unstable housing or homelessness, if you don't know where you're going to sleep that night, is going to the HIV doctor and filling your meds really going to be your first priority. Food insecurity is another reason, trauma, and stigma, whether that's stigma from other people or stigma that you are feeling about yourself. So those are some of the reasons that folks might have a hard time taking their meds. So after my daughter was born, my mental health, my substance use, it really started spiraling. And then her father went to prison for drug sales. And shortly after that, my own drug use was ramping up. So I started to sell drugs to support my habit. And I was arrested for selling drugs. And I faced a lot of stigma when I went to jail. They were like, we're going to keep you over here until someone says it's okay for you to be around the other incarcerated people, which was really ignorant because HIV is not spread by casual contact. And it was a really kind of a horrible experience. So I ended up getting out of jail while I was going to court to see what sort of sentence I was going to get for selling drugs. And I got scared and I ended up running away to Texas because I just was so overwhelmed. I wasn't dealing with my HIV. I was overwhelmed with the prospect of going to jail. And I kind of had this feeling like I'm going to die. I'm going to die soon. So I'm not going to spend the rest of my life in jail. So I think there was some elements of also having some post-traumatic stress disorder that wasn't treated in there. So I did end up leaving the state, and then my life in Texas was very similar to what my life was when I was homeless in Minnesota. I did sex work, I was using drugs, I was in abusive relationships. At one point in time, I did have, lost my train of thought. So I'm in abusive relationships. I'm not always practicing safe sex. So I had one experience once where I had sex with a casual partner and we used a condom, but at first, I gave him a little bit of oral sex before he put the condom on just to get everything going. And then I had a really funny feeling in my throat and I felt like my throat was closing within a couple of days after that. And then it just kind of went away. So I was like, that was weird. And I kind of went on about my business. And then I ended up having a different partner. And I got a call from him one day and he was at the clinic and he had been diagnosed with gonorrhea and he had it in his throat. So that's something I want to talk about today. You need to get tested for STIs wherever you are having sex. It's called triple site testing. Peeing in a cup is not going to tell you anything about whether or not you have an STI in your mouth or in your butt. So you always want to let your healthcare provider know if you're having oral sex, if you're having anal sex, you're having vaginal sex, because you need to be tested at all three sites. So I got a call from my partner. He was letting me know that he had been diagnosed with gonorrhea and he had some pills for me. So that's something called expedited partner therapy, where one person goes into the clinic, they are diagnosed with an STI, they know what partner it came from, and the clinic gives them pills not only to treat your STI, but also to bring home to your partner. So my life was really, kind of hectic at that point. I couldn't, spiraling out of control again, and I was not taking my HIV medications, and I was not seeing an HIV doctor. And I lived down in Texas for 4 years. So towards the end of that 4 years, I started to get a lot of symptoms that let me know my immune system wasn't doing very well. Specifically, I started getting herpes outbreaks every month, which is really, really frequent. And most people living with herpes, they're not going to get outbreaks that frequently if they're having a healthy immune system. And then I was also getting things like staph infections, a lot of infections of my skin, fungal infections, just weird things that kind of wouldn't go away. And even despite all that, I was just really in a place in my life where I felt so much shame and so much stigma around the HIV that it was easier to just be in denial. It was something I couldn't deal with. It felt like my whole life was out of control. I have this, I have to go to prison eventually. I have this HIV that I feel really bad about, feel like no one will ever love me. So at that point, I was getting towards the end of the asymptomatic phase here on this graph, because I was starting to have symptoms. And that means that there was more HIV replicating in my body again, and that my T cells, or my immune system cells, were getting lower and lower. And by them being lower, that's what made my body get sicker or have a harder time fighting off different illnesses. So this all kind of came to a head when I came home one day, 4 years after I had left. I was hoping to visit my family for Christmas, and I went to jail. And when I got to prison, I went to jail, and then I was sentenced to prison. And when I got there, one of the first things they did was the HIV specialist at the prison did some lab tests, and then she called me in to meet her. So when I went in to meet her, she sat me down and she said, "Mariah, I need you to know that you have an AIDS diagnosis now." So one of the chat questions I put in here, what do you think of when you hear AIDS? And share something in the chat if you want to, but my first assumption was, oh my gosh, that means I'm going to die. And it was really, really scary. And I almost took it harder than, the first being diagnosed with HIV, because at that moment I knew this is bad and I can't stay in denial anymore about this. So she went on to explain to me that an AIDS diagnosis, it really means one of two things. It means that your T cell counts have gone under 200. So in every drop of blood, a healthy immune system, you would expect to see 8 to 1200 of these T cells. So in a person living with HIV, if that number dips under 200, that is the cutoff for an AIDS diagnosis. The other thing that can happen to trigger an AIDS diagnosis is if you come down with what's called an opportunistic infection. So these are infections that a healthy immune system would normally be able to fight off, but because HIV is impacting your immune system, you get one of these infections. They're called like AIDS-defining illness. So Kaposi sarcoma, back when AIDS first came around, and if you've ever watched some of the old movies like Dallas Buyers Club, and they would show people getting these skin cancer, these lesions, that's an opportunistic infection. So what an AIDS diagnosis means now, with the current medications that we have, it means that at one point in time, one of these two things happened. Your T cells went down, or you had an opportunistic infection. What it doesn't mean is, it doesn't mean you're going to die soon. It doesn't mean that you are really sick, because the medications are so good that you can start taking them and get your immune system back up to a healthy level. And that's what I did. I started the medications in prison, and I was really quickly kind of able to get to an undetectable level. So the goal of treatment is to suppress the HIV in your body so that when they look for it with a blood test, they find a few or no copies. So that doesn't mean you're cured. The medications are really, really good, and they can kill all the HIV that's circulating freely through your body. But you have T cells that have HIV inside of them that like to hang out in your bone marrow. And these are dormant T cells. So you can think of them as sleeping T cells with HIV inside. So they're not out replicating or anything like that, but they're still there inside your bone marrow. So when those cells wake up and activate, HIV medications kills them, but the HIV meds can't reach those cells that are sleeping inside your bone marrow. So the goal of treatment, though, is to have your HIV viral load be undetectable. So meaning you don't have HIV circulating freely throughout your body. It's just, again, in your bone marrow, and that's where we can't reach it. So a person with an undetectable viral load has a normal lifespan, and they are healthy, and typically as you see that viral load go down from the medications, you see your T cells go up, showing that your immune system is strong again. So now I've been on meds continuously since 2012. My viral load has been undetectable the whole time. And the last time I got my T cells checked, they were 750. So I started at 186 when I got my AIDS diagnosis, and they went all the way up now to 750 through the medications. So even though I have an AIDS diagnosis, and I always technically will, that doesn't say anything about what my health is right now. So AIDS diagnosis or AIDS is just, it's a really stigmatized word, and it carries a lot of kind of emotional attachments to it, and people can react to it really strongly. So let's see. Yeah, so, and then I started to learn when I was in prison that HIV is really different now. So again, with the medications, you can expect to have a normal lifespan. A lot of people might remember back when HIV was new and they used to talk about all these cocktails and people had to take handfuls of pills. Most people have options to take just one pill a day. And many people have few or no side effects from their medications. I have typically few side effects. I feel like it's a little bit harder to lose weight now, but that might also just be a part of the normal aging process. I see my HIV doctor 1 to 2 times a year. Once we got it under control, you don't need to go in frequently at first when a person is newly diagnosed. Or if you are returning to HIV care after being out of care, you may have to see your doctor more frequently until things get stable. But once you're in a good place, it's usually once or twice a year. And then you get your lab test done 1 or 2 times a year. And that's when they make sure that you're still undetectable. And they look at how many T cells you have and like the ratio of the cells in your immune system. So this is really, really different. And a lot of people don't realize how different HIV is now. So I got out of prison and I ended up becoming a volunteer HIV educator because I was like, this has been my secret for so many years. This has given me so much pain and shame. And I know that if I want my life to be different after prison, I need to let my secret out and I need to come out of the closet. So I actually found a 2-day training course and started to teach HIV kind of 101s, kind of like I'm doing here tonight. And that really quickly turned into a job for me. And my job was doing community education. And one part of my job was to stay on top of new HIV research that was coming out. So I remember one day, I'm doing, who gets paid to sit there and Google things on the job? Like, this is great. So I was staying, looking at the new HIV news that had come out, and I started to read about a study they did. And I learned something that would change my life. I learned that when you are undetectable from your HIV medications, your HIV becomes untransmittable, meaning you cannot give HIV to anyone through sex, even if you don't use a condom. And this was really life-changing because one of the fears I always held on to with the HIV was, will I ever have a normal relationship? And will I ever be able to have normal sex? And there is no normal sex, right? But I was thinking, I would have to use condoms for the rest of my life. How would that work if I wanted to have children? And I felt a lot of shame at first. It kind of felt like the love that I had to give other people could hurt them. So learning that I was no risk to my partners, it really dissolved a lot of that stigma and that shame that I had been carrying around, at this point for 8 or 9 years of my life. So undetectable equals untransmittable, or U equals U is kind of the catchy phrase they created to educate about this subject. And it's just saying, hey, if you are living with HIV and you take your meds and you get undetectable and you keep taking your meds and stay undetectable, there's no risk for you to give HIV to your partners. So this is based on a lot of really robust evidence and large studies. And I put some of them up on the screen. So as you can see, they have followed thousands of couples where one person was living with HIV and one person wasn't. Followed them for a significant amount of time through many hundreds of thousands of times of them having anal sex and vaginal sex without a condom. And there have been 0 transmissions of HIV. So there are 0 times that a person gave HIV to their partner when they are undetectable. Throughout the history of HIV, there has never been a single confirmed case. And that's because the medications are doing their job, right? They're suppressing that HIV so it's not freely circulating through the blood and the semen and the vaginal fluid and the breast milk and things like that. It's just, as I said, it's kind of there in the bone marrow, and that's what we need to work on for a cure. How do we get to that sleeping HIV so that we can completely cure someone? So this was exciting. I found that out, and one of the first things I did was download a dating app. I was like, okay, I'm ready. And then I also learned about a new HIV prevention method called pre-exposure prophylaxis, or PrEP. So the word prophylaxis means you're preventing or controlling the spread of an infection or disease. And PrEP is when a person takes a daily pill, so they take it every day, and then that builds up a protection inside their body. So if they get exposed to HIV through sex or through sharing syringes, they will not become infected with it. So I like to say you can kind of think of PrEP as a birth control for HIV. So it's a pill you take every day before you have sex to prevent something from happening. So a little bit about how PrEP works in the body. So you can see there's a germ here, and your immune system cells like to eat the germs. They're your fighter cells, your T cells that I've talked about a few times today. Well, with HIV, when your T cells goes to eat them, HIV is like, great, this is exactly what I was looking for, because those are the cells that HIV hijacks to start making copies of itself. So then it makes copies, and that infects other T cells, and eventually a person is infected. Well, with PrEP, with you taking these pills every day, it builds up a layer of protection around your T cells so that HIV cannot get inside, not start making copies of itself, and it cannot infect you. And PrEP is really great. It is free with all insurance companies, and that includes not only the cost of the medications, but cost of you getting your labs done to go on PrEP and things like that. It is effective. It reduces the risk by 99% when taken daily, and it is safe with some people have mild side effects, some nausea, stomach pain, things like that. They usually go away within a few weeks of starting treatment, headache. And you can find PrEP at, I put a website right here on the slide, preplocator.org. Also available at every Planned Parenthood, and I think that Walgreens and CVS clinics now also offer PrEP. So, and then let me just make sure y'all are still here. Put a 1 in the chat if either new U equals U or PrEP was something new for you, or put a 2 in the chat if you already knew about both of them. And then we've got a few more things to cover. Yay, we got some 1s in the chat. So good that folks are learning something new. So, you know, and as I said, after prison, I started doing this job, doing the education. I learned about PrEP and U equals U and realized that, hey, my life is really, really normal with HIV, and I don't have to let it prevent me from living the type of life that I want. So I started dating. I eventually did get married to someone who didn't have HIV, and I could feel confident that me taking my medications every day would stop him from getting it. And it felt good to feel safe with that. And then I worked a couple years doing HIV education and testing for different nonprofit organizations. And then back in 2016, I went to work for the state of Minnesota. And first I did communications work, focusing on HIV and STIs. And then my current role is leading Minnesota's statewide plan to end HIV. And I do a lot of advocacy. So I'm going to wrap up the presentation talking about my advice for talking to clients. So something I ask everyone that I talk to is, what are your pronouns? Because it's always good to remember, not everyone who is pregnant or giving birth is a female. There are people who were assigned female at birth, but later on realize that they are men and they can still get pregnant and give birth. So I think asking pronouns is just, and sharing your own pronouns is a really respectful way to be inclusive of trans folks or gender non-conforming folks. You can say things like, I ask everyone these questions and I talk to everyone about this. Don't yuck their yum. So that means if someone shares something maybe about sex they've had or things like that, as you're talking about sexual health, don't ever judge people. Don't yuck their yum. You like people other things might not like, and vice versa. So just be really, it's important when you're working with clients and anyone to just be really open, be a safe person to come to, be non-judgmental, and to each their own, right? You can ask questions like, when was the last time you got tested? When was the last time you had a pap smear? If they're pregnant, do you know if you've been tested for syphilis or HIV yet? And things like, have you heard about PrEP? And have you heard about U equals U? Because these are really new advancements and not everyone knows about these. And we should, definitely share the news. If you want to help your clients get tested for STIs or HIV, I've put a couple of ideas on the screen. Planned Parenthood is a good one. Public health clinics, depending on where you live, there's often like a clinic associated with the county that's free or no cost. At your OBGYN or your general practitioner, there is a free testing locator at gettested.cdc.gov where you can search by zip code to find free testing near you. And then there's also a website that does free at-home test kits, so you can test in the comfort of your own home, and then send those off through the mail. And that website to see if they are available in your area is takemehome.org. And then finally, something you can do is to fight stigma. Make these things okay to talk about. STIs are really, really common. In 2018, it was estimated that nearly 1 in 5 people have or have had an STI in 2018. 1 in 5 people. And most of those folks are people aged 15 to 24, so more common among younger folks. But STIs are so common, but our society, there's so much shame and stigma that it's not something we talk about freely with each other. And, that causes a lot of unnecessary shame, a lot of unnecessary health complications, so make it something that's okay to talk about. Correct myths and stereotypes if you hear them. Educate yourself and others. Again, spread the word around PrEP and U equals U, because you just might change someone's life. It's really significant. And a lot of people, they don't know about U equals U yet. These are recent studies. This is a more recent development. And then use supportive language that is not stigmatizing. So I put up here some of the language I suggest using. Instead of saying unprotected sex, try using condomless sex or sex without a condom. And I say that because now that we have PrEP, now that we have U equals U, you can be having sex without a condom. You could be having sex without a condom that is still protected by PrEP or U equals U. So kind of being more specific, what are you talking about? Condomless sex. Instead of HIV infected, say a person living with HIV has AIDS, say living with HIV or living with advanced HIV. Again, AIDS is a really kind of an outdated term. It used to mean something back before we had the really good medications, but now it doesn't. It's lost a lot of its significance, and most often than not, unless you are talking about a person's like medical experience of having an AIDS diagnosis, just saying living with HIV is just as accurate. Full-blown AIDS is not a term to use, so just take that one out of your vocabulary. And then again, you can say AIDS diagnosis, advanced HIV, or just living with HIV. It's not the AIDS virus, HIV, it's human immunodeficiency virus. So you can just say HIV. Instead of dirty needle, say shared needle or shared syringe. Don't ask someone if they're clean. I take a shower every morning, so even though I'm living with HIV, I'm still clean. I'm not dirty, right? That's just a really stigmatizing way to talk about STIs. So don't say, are you clean? Just say, have you been tested? Do you have any STIs? If someone lets you know that they are living with HIV, it's super rude to ask. I mean, I know I just sat here and told you all my business, but it's really, it's rude to ask, how did you get it? Something better to say would be, thank you for trusting me. And are you in care? Are you undetectable? Have you heard about U equals U? Things like that. Promiscuous, that's kind of a very judgy word. So has multiple sex partners is a better way to say that. And then instead of prostitute, try sex worker or does sex work. And I think I'm getting to the end of my presentation now. So I know we have left time for Q&A in the last little bit of the webinar. So I will just pull up the Q&A screen to see if any have come in. So now would be the time to type your questions. All right, Tanya asks, what is one policy you would say could make a huge impact with HIV and the criminal legal system? Well, thank you, Tanya, because there is actually an intersection between HIV and the criminal legal system, and that is HIV criminalization. So back when HIV and AIDS were first kind of hitting the scene and not everyone knew what was going on, there was a lot of hysteria, there's a lot of judgment, there's a lot of stigma, and a lot of states made these laws, and it's called HIV criminalization, where a person can get in trouble for exposing other people to HIV. And these laws are really, really problematic for a number of reasons. One, they're not based in science. So in some states, there are people who have gone to prison for spitting on someone just because they have HIV. HIV is not in saliva. It can't be transmitted through spitting. So it was impossible for HIV to be transmitted in that case, and yet still here's a person sitting in prison for years of their life. In some states, you can be prosecuted. They will prosecute you even if HIV wasn't transmitted, just if there was an exposure. So let's say two people had consensual sex. One of them had HIV, one didn't. That other person didn't get HIV, but they come back and say, you didn't tell me. And that person, there are people going to prison again for decades, even though transmission didn't occur. There are people going to prison for decades for scenarios where it's impossible for HIV to transmit. There was somebody in Iowa that got like a 30-year sentence for having oral sex without a condom, and he was undetectable. So we know HIV is not transmitted through oral sex, and we also know HIV is not transmitted once it's undetectable. Yet here is this person in prison who will have to register as a sex offender when he leaves prison for the rest of his life, just for a law that's really based in stigma and not in science. So it is, everyone is responsible for their own sexual health. And most people living with HIV, they find out they have HIV, they say, how can I not give this to anyone? I mean, the media likes to sensationalize things and focus on times where maybe a person did not share their status with their partners. Living with HIV is really complicated. So I invite you all to think about what it would be like to live with that really, really stigmatizing diagnosis, especially if you are not, don't have access to good education. Maybe you're a gender or sexual minority and you have healthcare providers that discriminate against you, and think about scenarios where it might be really, really hard to disclose to your partner. And that doesn't mean that you're a bad person or that you want to give HIV to someone else. But I can think of situations where, let's say a person is diagnosed with HIV and they have a very abusive partner, and they're worried about what their partner might do to them if they disclose their status. Or, you know, what if a person is actively using drugs and they are diagnosed with HIV and they have needle sharing partners, and they've all been, you know, needle sharing partners for 6 months, and then they come and say, oh my gosh, now I have to tell them or stop sharing. Like it's really, people living with HIV sometimes have really complicated lives, because it's really a disease that's about unequal access to healthcare. It's about unequal access to education and resources and opportunities. So HIV, it really disproportionately affects groups that are already marginalized: sex workers, you know, gay men, bisexual men, racial and ethnic minorities, so people who inject drugs. So it's already people many times that don't have access to the support they need. So yes, that was my HIV criminalization tangent. Those laws are not based on science. They have not been shown to improve public health. In fact, it has been shown in states where there are laws criminalizing HIV that actually decreases HIV testing numbers. So it's actually harmful to public health. And then, do you know of organizations who are currently working to change these policies, or how we can get involved to help end these policies? Yes, the SERO Project, SERO, is a national organization working on the issue of HIV criminalization, because HIV should not be a crime. Do you have advice to support people living with HIV and mental and emotional health? Yeah, absolutely. I think that sometimes just having a safe person to talk to and a supportive person can make a world of difference for folks living with HIV. And I would also say, you never know who in your life might be living with HIV, because so many people feel like they have to keep it a secret. So if you can proactively be an advocate about HIV in your life and share things like, did you know about PrEP? Did you know about U equals U? That can signal to folks in your life that you are a safe person. I also recommend therapy. So people living with HIV in the United States that meet certain income guidelines, so most people that need it can get it, are eligible for a special type of funding called Ryan White funding. And that pays not only for HIV medications, but also supportive services for people living with HIV. So things like mental health care, substance use care, it can help with housing, legal assistance. There's a lot of resources out there for folks living with HIV. So I would say, be a safe person to talk to, listen, ask, you know, people you are supporting what support they need from you. You know, would they like you to go to a doctor's appointment with them? Do they want you to listen? Just ask them what they need, and then encourage them to seek mental health care or therapy if they are having a hard time dealing with their diagnosis. And oftentimes, many people living with HIV do feel like connecting with other people living with HIV can be helpful for them to kind of accept their diagnosis and come to terms with it, because you see out there, it's really scary and lonely at first, but then when you meet other people living with HIV and see, okay, everyone's still out there living their best life, that can really be significant to help someone's mental health and their acceptance. What was the most helpful thing you have done to move past the fear of stigma? Yeah, I would say the bravest thing I did, which was probably one of the most significant moments, was when I was incarcerated. I was in a program, and part of that was sharing your life story with other people in the program. And I'm about 26 years old at this point. I got diagnosed with HIV at 19. And for all those years, it's been my dirty secret. And I used to tell myself, yeah, they're your friends now, but if they knew your secret, they wouldn't be. Yeah, he likes you now, but if he knew your secret, he wouldn't be. Everyone would reject you. You wouldn't have anyone friends, you know. And I would hear people in the prison saying stigmatizing things like, oh, people like that, they should have to use their own washing machines and stuff like that. So it was really scary. But I said, if I'm going to do my life story for this program, I'm going to do it right. And I'm going to stand up and tell my secret. And that's what I did. And it was a group of about 30 women that I had come to know and love. And when I said, you know, I told them the story and how I was diagnosed with HIV, and I was looking at everyone and I was expecting to see fear or disgust or rejection. And instead, everyone was crying. And so many people came up to me afterwards and they were like, it could have been me. And you're changing the way I feel about HIV. And thank you for sharing your story. And that's when I realized, okay, I can turn something painful in my life into a purpose, and I can help others, and I can make it make sense of why I went through all this homelessness and trauma. If I can use my story to help others and let people know, well, HIV is totally preventable. So let me get you the up-to-date info. But if you are diagnosed with HIV, your life can be completely normal. It can be great. I like to say that I'm thriving with HIV now. And that point was really probably one of the biggest things I did to get over that internalized stigma in my own life. All right, we got another question in the chat. Has my family been supportive on my journey? Yes, but at first they didn't know how. So when I first got diagnosed, I called my mom and I told her on the phone, and I was really upset, you know, and everyone's like, what's gonna happen to a baby? It was a very emotional time. And then she ended up telling my little brothers. And I was really upset because I wanted to be the one to tell my little brothers. And she kind of like, well, what if you bleed or something happens, open cut? And I'm like, I moved out of the house. How often do I come home and bleed all over my little brothers? Like, no, that's not how this works. So as time went on, they showed me that they were learning more. I remember I was in prison and my mom sent me like an article in the mail. I'm like, oh, they're learning more now. And now they are so proud of me. And my mom is out there, you know, spreading the word with everyone she knows. And she knows all about U equals U and all the stuff that I hear about. So yes, I have been really fortunate to have a supportive family, but not everyone has that. You know, a lot of people living with HIV, they've been kicked out of their homes for having HIV and their family finds out. They've had people that they trusted in their family running around, you know, disclosing their status to other family members or in their social groups. So I've been extremely lucky to have a supportive family, but that is really not the experience of everyone. So sadly. All right. Well, I know we have a few more minutes. If there's any other questions that folks have, you can pop them in the chat right now. Oh, were all of your experiences positive when you disclosed your status? No. So I had a hard time telling people that I had HIV when I was dating before prison. And I didn't always tell them. After prison, I was like, okay, I'm not gonna, date anyone without letting them know that I have HIV. Even though I know I'm undetectable, I can't give it to them morally. I want to tell people. And I also, if I'm going to be with someone, they need to understand what I'm dealing with. So it's kind of like a skill. It's kind of like job hunting when you have a felony, during a time where you're putting your best foot forward and trying to show someone why they should like you. You know, you have to tell them something that is really kind of stigmatized, and it may scare people off. So like all new skills, you have to kind of learn. So I would experiment. I'm like, should I tell someone right away on the dating app? Should I have a few dates with them? Should I, you know, talk to them on the phone, but before I meet up in person, should I let them know? And you know, sometimes that didn't always go great. So I ended up telling one person that I was living with HIV. And we had only been chatting like through the dating app or whatever, and we hadn't really met up in person. And I told them, and they were like, oh, okay, yeah, it's fine, whatever. I educated them. And then when we met up in person, I got a lot of bad vibes from them and like red flags. So I ended up telling them that I didn't want to talk to them, and, you know, kind of discontinued that. And they had made a fake Facebook account, and they put my picture and my name and my status on this fake Facebook account. They had like thousands of friends. I think that like mentally there was something wrong with that person, that they had this fake account that had been up for years. But all of a sudden, it was all over the internet. And he basically said that this bitch is out here lying and spreading HIV on purpose. And there's people in the comments saying, you know, I should be shot and all sorts of things. And it was devastating because I wasn't spreading HIV. I was telling people, which is what I was supposed to do. And, you know, and Facebook said they wouldn't take it down. It wasn't hate speech, but, you know, that had always been kind of my worst fear. And when it happened, I was kind of glad it did, because yes, it sucked, but I got through it because I had a good support system. I had a good best friend. I had a good therapist. And I realized that like my biggest fear when it happened, it wasn't as bad as I thought it would be in my head. And it really, really sucked for a couple of days, but then I got over it. And I've never really been kind of scared like that ever again. And to Piggy, let's see. I also had an experience when I met my husband. His family found out my status through a mutual friend before, well, my ex-husband, excuse me. His family found out my status from a mutual friend before I had had a chance to meet his family. And they showed up at my house where he was living with me and like packed him up to save him from me so he wouldn't get infected with HIV. And they treated me really, really poorly at first. So those are some, they're not all good experiences, but eventually his family did end up coming around as they learned more. A lot of times when people stigmatize you, it's because they have a really outdated understanding of HIV. And most reasonable people, when you say, well, here are the facts now, and you know, you can't give it to anyone, you don't have to worry about this, you have a normal life, most reasonable people will adjust their viewpoints. And people who don't want to adjust their viewpoints when they are confronted with new evidence aren't reasonable people, and they, you know, often don't need to be in your life. One more question to piggyback off of that. Have you felt support in your career through coworkers or others in advocacy spaces? Really good question. So when I first started my career, I didn't know a lot about being an advocate or what it meant to be at the table or why it was so important to have people with lived experience at the table. And I felt, reflecting back now, I feel like in some ways I was tokenized. Early on in my career is like, oh, well, you know, we have the one person living with HIV on the staff, so we're going to bring them out during fundraisers and this and that, and we want to invite you here to share your story, and we want to invite you here to do this panel, but they weren't like paying me and things like that. So I think early on in my career, I was supported, but I also feel like in some ways I was used for my story. And then I also feel like sometimes people just saw me for my status and they didn't recognize like the awesome skills that I was bringing and that I was kick-ass at my job, which has nothing to do with whether or not I have HIV. So sometimes people would pigeonhole me, if that makes sense. But as my career has progressed and I've learned more, I have become a really strong advocate for people need to be at the table. And we don't ask people to work for free. If you want someone to come to your panel or come to your advisory board or come to your meetings and give their input, you need to compensate people for their time and their expertise, because they are the experts at their own lives. So I would say that's, and at this point in my career, I do feel supported, and I also know how to stand up for myself and stand up for other people so that we aren't doing more harm to people by using them for their story and their input without then making sure that it's mutually beneficial relationship. Other questions? All right, back to you, Tanya. I saw you come back.
I just want to say thank you so much, Mariah. It has been such an honor to share space with you, to hear your story, to listen to your wisdom and your knowledge, and really just be able to, I just want to honor you. It's you are a dear friend of mine, and it's an honor to be in your life and to have you here. I want to thank everybody that joined us tonight. If you did not get to see the whole presentation, don't worry, we will be posting the replay. We also have this recorded, and if you would like to watch it, just reach out to us. I also want to let you know that we do have other workshops coming up in the series, so stay tuned for that. And thank you all, and have a great evening.
Thank you, Tanya. Thanks for having me.
Thank you.